Hi everyone, my name is Melina McCabe, and I am a sophomore biomedical engineering major here at WVU. My research is in the field of biomechanics and focuses on differences in stepping characteristics during the TUG test with aging and neurodegenerative disease. First, appropriate stepping characteristics are necessary for walking stability. During walking, characteristics such as maintaining a normal step length and width and keeping step parameters consistent are important to maintain balance. Underlying conditions, such as aging and neurodegenerative diseases, may lead to a decline in walking performance and ability. Differences in gait parameters may represent underlying neuromuscular changes that affect walking in people with these conditions. The goal of this study is to determine how walking step parameters are modulated during the TUG test with aging and neurodegenerative disease. For the experiment, 5 healthy young adult subjects, 1 middle-aged adult subject, and 1 middle-aged adult subject with diagnosed multiple sclerosis, or MS, were tested through a series of walking trials. Vicon motion capture cameras were used to capture step parameters. Each subject completed a minimum of 4 trials of the timed up and go, or TUG test. During this test, subjects stand from a chair, walk 3 meters, turn, and walk back to the chair as quickly as possible. This test is often used as a clinical benchmark for walking stability and independence because the movements in this test, such as the sit-to-stand motion and the turn, are challenging scenarios during which falls often occur. The data was analyzed using a custom-made MATLAB code. Step length and width were calculated as distance in the anterior, posterior, and medial lateral directions respectively. Step variabilities were calculated as the standard deviation of step length and width between all steps. In this study, only the straight line walking portions of the TUG test were analyzed, and step parameters were compared between the 3 groups. Results show that step length and width are affected by MS, but not aging. A large decrease in step length was found with MS, shown by the large effect size. This is most likely because people with MS often take shorter, slower steps to maintain stability. Also, a large increase in step width was found with MS. This is most likely due to the fact that people with MS may use a larger step width to cope with gait instability. Further results show that step variabilities are affected with aging and MS. A large increase in step length variability was found with aging. This is most likely because consistent foot placement is harder to maintain with age. Also, a large decrease in step length variability was found with MS. This is most likely due to the slower, shorter steps found in people with MS. Furthermore, a medium increase in step width variability was found with MS. This is most likely due to the gait instability found with MS. This study demonstrates that both aging and multiple sclerosis result in altered stepping characteristics that are often associated with gait instability. These altered stepping characteristics most likely help people cope with gait instability and represent underlying neuromuscular changes that lead to an increased fall risk with aging and MS. These observations could eventually be used to develop better rehabilitation techniques and practices for patients with these underlying conditions. Furthermore, future work will include expanding sample size and analyzing different parts of the TUG test to determine how different walking scenarios affect step parameters. This study should also be repeated with different neurodegenerative diseases to determine differences in walking step parameters between conditions. I would like to thank Dr. Jessica Allen, Hannah Carey, the Research Apprenticeship Program, and the Summer Undergraduate Research Experience for making this research possible.